Our casualty is unresponsive and lying on the floor. So we're now going to practice DRSABC. The D stands for danger. Check it's safe to approach your patient. There's no vomit on the floor, broken glass, or anything that could injure you. Particularly important if you're outside that there's no road vehicles that could harm you. Having established it's safe to approach the patient, the R stands for response. Always begin by shouting at your patient, because hearing is the last sense to go, so they may be able to hear you even if they can't respond. Shout at them clearly, but if there's no response, then firmly squeeze their shoulders and continue shouting at them. If the patient doesn't respond, the S stands for shout for help. So call for a colleague, or if you're on your own, take out your mobile phone, dial 999 and put it on speakerphone. Tell them you have an unresponsive patient and you need help urgently. While you're waiting for the emergency services to arrive, you can go through the ABC. The A stands for airway. First of all, check the patient's airway is clear. If there's any obstacles you can easily remove, please do so. But don't poke your finger into the patient's mouth, as this could make the situation worse. If there's vomit in the patient's mouth, tilt the head to one side, massage the cheek to try and get some of the vomit out. Don't take too long, 6 or 7 seconds just to clear their airway. Once their airway is clear, carry out a head tilt chin lift, which is putting one hand on the forehead and 2 fingers on the bony part of the chin, and tilt the head back. This lifts the tongue away from the back of the throat and allows the patient to breathe normally. Now look along their chest to see if they're breathing. B for breathing. We're going to count up to 10. If there's no signs of normal breathing during those 10 seconds, and for an adult, we're looking for 2 or 3 rises and falls of the chest during those 10 seconds, then the patient is unresponsive and not breathing normally. We're therefore going to begin CPR, the chest compressions. Place a hand in the center of the chest and push down 2 inches to 5 centimeters. A good rhythmic speed, 1 or 2 beats per second, 100-120 beats in a minute. Keep doing the chest compressions. This is what we call compression-only CPR, and is the minimum you might want to do while you wait for the emergency services. However, you could also consider rescue breaths. To carry out rescue breaths, which are particularly important on children, give 2 rescue breaths to every 30 chest compressions. Begin by pinching the patient's nose and tilting the head back as you did before, putting your mouth over their mouth and blowing into the patient. About 1 second for each breath. Watch the chest rise and fall each time. After the 2 breaths, resume the chest compressions, 30 chest compressions again. You may have in your first aid kit a pocket mask. These are particularly good for first aid as they protect you from breathing in germs and vomit that might be in the patient's mouth. Pop the pocket mask out of the box and place it over the patient's nose and mouth. Push down firmly with your thumbs on each side of the valve. This will leave your fingers free to grip the patient's jawbone and tilt the head back. And then, as before, blow firmly into the patient twice, allowing about 1 second for each breath and watching the chest rise and fall. Once you've given 2 rescue breaths, resume the chest compressions. 30 chest compressions to 2 rescue breaths. Keep going until the emergency services arrive to help you.